Hi, my name is Marcelina and I'm going to perform the neck vessels, the heart, the lymphatic system, and the peripheral vessel assessment. I'm going to start with the heart. Normally, before we start, we'll do a blood pressure, make sure the blood pressure is okay. We're going to assess the skin integrity. There is no lesions, there is no swelling, there is no cyanosis of the chest. I'm going to listen to the heart sound. Usually, the apical pulse is located in the fifth intercostal space, and I'm also going to listen to the apical pulse and listen to the heart for normal sounds. And usually, when we're listening to the heart, we are looking for any abnormal murmurs or any irregular beats. So right now I'm going to perform the auscultation of the heart. You can breathe normal. You don't have to. There were no irregular beats. The heart sound regular and normal. Now we are going to perform the neck veins. I'm going to do the carotid artery first, and I'm using my two fingers. I'm going to press one at a time on each carotid artery. And again, when we're performing this test, we're looking for non-boundy. As we palpate, it shouldn't be boundy. The other side as well. And then now I'm going to auscultate them. Take a deep breath for me and exhale and hold it. Okay. Take a deep breath, exhale and hold it. Exhale and hold. I didn't hear any bruit, which is an abnormal finding. If the carotid artery are, when we listen to the carotid arteries, there should be no bruit, which I did not hear any bruit there. Now, the jugular veins, they should not be distended, and there is no sign of jugular vein distension. Also, let me let you lay down for a few minutes. I'm going to see if the jugular veins get distended. There is no distension of the jugular veins. You can see like okay. Now, I will be doing the peripheral veins. I will be assessing the peripheral veins on both hands. First, we're going to palpate the ulnar and the radial and brachial pulses. Before I do that, I will be assessing the hands to make sure there is no sign of cyanosis, there is no nodules, there is no lesions on the hands. And I will palpate, first I'm going to palpate the brachial, on both hands. Then they should be both symmetrical, normal. 2+ is normal. Okay. Let me see both. So I'm palpating the radial pulses and they both feel normal. Don't close it up, just keep it. And now the ulnar pulses. And again, they're supposed to be both the same, and they're non-boundy, nice and smooth pulses. I'm going to assess the epitrochlear pulse. And these are located between the bicep and triceps. Okay. Good. I'll do the same on this hand. I'm going to perform the Allen's test, where I press down on the apical and the radial pulse both at the same time. And can you open and close your hands while I do that? Can you open and close your hands? Okay, open. Now we see some decrease in blood flow in the hand. And I'm going to release the ulnar artery. I'm going to release the ulnar artery, and the hands becomes again nice and pink. Right? See that? Becomes nice and pink. And the epitrochlear pulse should never be palpable, but we can see as we do the test that when the hand loses the perfusion, it becomes, the perfusion returns as soon as I release the ulnar pulse. Now, I'm going to assess the hands for edema. There is no edema noted. Like I said, there is no lesion. There is no clubbing of the fingers. And we are going to perform now. Look at the legs. Now we're going to look at the legs and we're going to make sure that the hair distribution in both legs are the same. And I'm going to check for the dorsalis pedis pulse. So this is, make sure it's there. You can see this one as well. Going to the popliteal pulse are located right B. You can lay down. Bring yourself a little bit up. Bring yourself up a little bit. Okay. Bring the legs down. Also, we can perform the femoral groin. There is lymph nodes, and there are arteries, the femoral artery that we could palpate, and we can palpate that on both sides. And as we palpate the nose and the arteries, we want to make sure that they both, the nose are not enlarged and they're movable. Most importantly, lymph nodes should be movable and not enlarged. The pulses are present and they're not irregular. Okay, so now I'm going to check for the popliteal pulse. Okay. And both pulses are present. Make sure. Okay. Let me see. I'm gonna press it. Is this tender? Does this feel painful or tender? No?